I know that EPA and AWWA had a webinar yesterday, but I think there were some technical difficulties with it, so a lot of the information didn't glean down the way we wanted it to. But as we get more of that information, we'll do our best to post it and share it. And as we get that stuff throughout the week, when we do our Wednesday updates, we'll make sure you guys have as much of that information as possible.
One thing we may want to do is advise all the listeners is that they can go to the EPA website, and the information that Dawn Ison gave out yesterday is available on that site for forms and checklists.
Perfect. So that'll be helpful. I know a lot of us feel like we're kind of creating things in a silo or in the dark. It's good to have that federal guidance on where we're going with things. If we can link in and grab that information, it'll help everybody out quite a bit. Our next slide is going to be the VDH COVID map, and Geneva went out about a half hour ago to pull the most updated information. So they're updating this every day about 10 in the morning, and so we're trying to keep it as real time as we can. And I think you'll see from what we reported last week, we're starting to see an increase, almost a doubling in numbers at this point for the total deaths and those that the reported cases from last Wednesday to this Wednesday. The perspective end date for this is still some time out, but our peak, well, some of the metrics for our peak here in Virginia is looking around April 20th. So as we advance to our next slide, I'll give it a few seconds because I know there's a lag. But our next slide shows that metrics. This is the slide or the information that Scott Shirley shared with us last week. Scott, did you want to speak to this slide again?
Well, yeah, I think the good news for those that have tracked this, last week we were seeing, and the model's updated again in the mornings and in the evenings with real-time data. And so I think this is beginning to see that we had some questions last week about were our mitigation efforts that we're kind of taking across the Commonwealth making a difference. I think the answer is a clear yes, based on what we're seeing in the difference in the model between what we looked at last week versus this week. And again, it's one of those things where the model is using best available data. And so the better that we see our cities, counties, or localities comply with the existing orders, we hopefully can even see this driven down further. So the important thing with the model is to always keep in mind that that's back looking in terms of the data that's loaded into it, and the actions we take moving forward can clearly make a difference in outcomes.
And the other thing I just want people to be aware of, as we hit that peak, that doesn't mean that we won't have new cases, but the rate at which new cases appear is definitely going to trend off until we no longer have new cases and we finish out the cases we have. But if you see the bottom side of that bell curve, it's taken us into right around June 1st, June 2nd. So we still have a ways to go with this, and anything can change. This is a good visual for where we are right now, and hopefully where things stay on track to end and it doesn't change in a bad way. But that possibility is there. There can always be a second flare up. But the other thing, if you're looking at the bottom of that curve around that June 1st, June 2nd time frame, that's hurricane season here in Virginia. So we need to be thinking ahead. Not only how are we preparing our operators to get through this, but how are we preparing our utilities to get through this next phase of issues that are coming our way. There's nothing like having one emergency stacked on top of another emergency to really stretch us thin. Based on this peak, I had gotten some guidance from Dwayne Roadcap, the director of ODW, this morning. And what he told me is EPA is not relaxing any monitoring or sampling requirement. VDH has enforcement discretion if the violation is associated with the COVID-19. So they have informed their field office staffs that VDH may not pursue the violation and can use alternate sampling locations. And then he gave me a website that we'll try and get out to you where people can look at the EPA guidance document on how this is working. So it'll be posted on their vdhvirginia.gov drinking water site on their webpage. So you guys can go there and pull that down and get more guidance on these compliance guidance that EPA and OTW is working on. All right. And then
really quickly, I'll interject.
Oh, go ahead.
We had someone let us know that our model had been updated from yesterday to today with regards to this chart that you're seeing now, or was in the slides. Mostly it has to do with the number of beds needed. It still shows the peak at April 20th, but it looks like a reduction in maybe the number of hospitalizations and hospital beds, and the curve is definitely a lot lower, and I'm displaying that on the screen for all the participants now. But it's
awesome.
It's reduced the peak as far as the unknowns.
And that's really good information to hear that we're starting to see a reduction. But the one thing I do want to keep in mind is wastewater operators and drinking water operators. I mean, this is a crucial time for us to stay focused and do our deliverables, which is what we do. But now we're doing it in kind of a stressed environment. But this is crucial to public health to make sure we get fresh water and sanitation out there and keep things going the way they're supposed to go. We'd hate to see this bell curve extend out because now we have some other sickness because we can't produce fresh drinking water and sanitation.
Well, Mike, I think you had an excellent point on the risk, because we are, even in instances in China, seeing a secondary outbreak initiated as they begin to wind down some of their restrictions. And so it's unknown whether we would face that in the United States, but I think it's prudent from a utility standpoint. The risk is that we all look at this and say, it's done as of June 1st. It may not be. And so from a planning and emergency preparedness standpoint, I think it's important emphasize the good to our employees, but also plan for a potential continuation longer than we expect.
Absolutely. And I guess, and this is going to go back to something else. I want to talk a little bit about this. One of the things I brought up last week. So you figure we have our last sickness, our last reported case on June 1st. You're still looking at a 14 to 15 day window after that before that person can return to service or come back to duty. So you're now looking about the middle of June before you're back to 100% of your staff. If you haven't, and I hate to say this term, but as a planner, it's one of the things I have to think about, if you haven't physically lost that staff permanently. So that's one of the things we're going to talk about, is that operator preparedness piece again today. One of the things I did talk to Dwayne about, and he's taking it back to VDH, is doing some map or providing some map overlay metrics on the VDH health map to help break it down by VDH health district, and to try to put another one in there for VDM response districts. So as soon as we hear back from him, we'll make sure we have an update on that for you as well. But they are actively, that they're really liking the suggestions you guys gave us last week, and they are working to make this better for not just the utilities, but the public in general. One thing he did remind me to tell you guys is that VDH health map, that's designed for the everyday person. It's less designed around the industry, because most people are just looking, hey, what's going on around me? And we're looking at it more from what's going on in our region or our section. So they're taking that to light, and they're going to see what they can do to help us out with that. All right, WARN updates. So far, so I'm on the slide that says WARN updates. So far, we have not seen any requests coming through WARN as far as assistance for operators, assistance for supplies or equipment or anything like that. But we do want folks to know that if you are a WARN member and you go in and you do a WARN request, as soon as you do that and you hit send, it's going out to anybody else that is a WARN member. So you're getting instantaneous feed out there to everybody. If you're a non-WARN member, I don't want you to be disheartened. If you're a non-WARN member, we have the request going through Rural Water. and we'll do what we can to help you. And then we've posted a lot of resources on our WARN page that you can go and pull down. And we're adding to it almost daily, new resources, new things that people are asking for. And from these meetings like we're having today, any information that you feel is crucial for you to do your business, please share it with us. If we can find a way to link it in and bridge that gap for you to find it and get it, we absolutely want to do that for you. I'm sure Scott and Mike feel the same way, if you guys want to weigh in.
Yeah, and actually, like we have a comment in question and answer in concern to EDMR reporting. This entity has 2 operators approved to submit EDMRs. Due to possible operator shortage, will DEQ accept a paper DMR? So that's something that we would suggest a direct contact to your regional DEQ office. Again, as Ike mentioned earlier, the state has, EPA's come out with their guidance, and the state has their interpretations. And so I think that's a valid question in terms of the EDMR, is talk to your regional office about whether a paper DMR would be acceptable.
And we will, on the WARN side, we'll reach out to DEQ through our contacts and see if they have a guidance or if they're handling it section by section. And if we can answer that question for you outright, we will. But like Scott's saying, it's best for you to reach out to your local office, whoever your overseer is, your person that's coming to review your documents, and talk to them direct and see what their guidance is. But that is an excellent question. That's one we'll definitely try to get an answer for. Does anybody else have a take on that, or how they feel that interpretation is?
I know personally our utility, we've had instances where there was a problem with the EDMR site. That very rarely happens, but we have had some unusual instances where a paper DMR was delivered to make sure that we had a timely report. So I think my suspicion is all the regional offices will be aware of that potential. And so I think that we'd find a discussion with the regional office to be very favorable on that aspect.
Absolutely. Okay. All right. I'm going to move on to the next slide here. And this is a slide that shows the WARN pages coronavirus updates. I believe Geneva wanted to speak to this one. Or it might be the next one.
Well, we just wanted to let you know that we have added some new links. As people share with us their information, we are posting it to the resource page. Anything that has been added since the last call will be marked as new in a little bit of a red bold lettering, so that way you can immediately come to the page and just check out new links and new information as it's posted weekly. And then after a week goes by, we'll probably just mark it as information and again, post anything that's new. So if you have information to share, please do send it to me, geneva.hudgens@vaawwa.org, and we will take a view of it, make sure that we can add it to our site and get it posted for you to share with others. Additional to that is the membership list. There was about 19%, I believe it was, on the poll that said that you are not aware of whether or not you were a WARN member. You can now see the utilities listed, not by contact name or personal information, but simply a list of utilities and service providers that are a member of the WARN. You can find that by underneath the news section, VA WARN utility members, the third item that's listed there on the left under news. So feel free to go there and take a look. If your utility is not currently listed, contact us. We'll have information at the end of the webinar on how you can reach us to ask questions and get that process started.
Perfect.
Geneva, may I make a couple comments?
Please.
Okay, for all those that are not familiar with WARN, there is no cost to become a member. If you look at your AWIA documents that you're going to have to put in place over the next several months, or some of you smaller utilities by December 30th of 2021, your WIA document has a place in it where you are encouraged highly to join your state WARN. So you can get ahead of the game there by go ahead and doing that.
Perfect. And one thing, one of the questions that was asked last week, and we discussed this, and we're going to try and get it on here. There's individual folks out there that would like to volunteer their capabilities or availabilities, and we're going to try to see what we can do to pull that together. I just want to put out there right now that the WARN doesn't sponsor or back anybody that volunteers, but nobody that's volunteering so far that I've seen or that has asked to is looking to do anything malicious. They want to help. And these are people that are in our industry. They're either consultants or they're former operators or are people who have knowledge and just want to help. We can't make them WARN members, but we can definitely put something on our page so you guys can reach out to them. And we'll ask, what we're going to do is for those folks that are looking, if you're on the call right now, if you're looking to assist, what we're going to do is we're going to request that you send us your name or your entity name and tell us what it is, what resource or what capabilities it is that you are willing to assist the utilities with. Whether it's you have some licensed operators on staff as your consulting company, or you have some engineering, or you have some expertise around helping do some remote monitoring, whatever it is, make sure you put it in there. So when people go to search you, to look to see what it is, what resources they're looking for, they don't have to keep going through and calling everybody to see if that resource is what you're offering. Just kind of give us a little synopsis. Geneva, did we discuss a form on how we want that done other than what I just said? Are we actually going to produce a request form, not a request form, but a form for these volunteers to fill out?
At the moment, we don't have a form. They can simply send it in by email, but the committee will be getting together and creating that at some point in the future.
Correct. So again, in the email, just tell us what your capabilities are, what it is you're actually able to volunteer or assist with. I keep using the word volunteer, and I shouldn't speak that everybody's volunteering their time, but what it is that you can do to help the utilities get through this. And that's both water and wastewater that we're looking for. So I'm looking at best practices slides. I believe that one advanced forward. And what we have here is, we talked a little bit about this last week about employee morale. Scott had some suggestions. And if you guys didn't hear it, I'll let Scott speak to his again. It was really good. But some of the things that we're looking at are shift competitions, which is kind of in line with what Scott was talking about. But also, one of the biggest things to help morale is keep staff notified. Let them know what's going on, your expectations, as well as any routine updates. And the next slide Scott's going to speak to also, it's about some verbiage and or how to notify your staff of a positive case inside your organization. Make sure your staff has a way to be engaged in the process, whether it's through suggestions or comments, or what I talked about earlier, this making these cloth masks. Maybe there's a family members that are sitting at home because they can't go to work and they're looking for something to do. Maybe there's a way to share that information so they can help with some of that PPE that we're having shortages on. Some of the comments that I got earlier, let me pull those up real quick. Bear with me here, folks. I apologize. So one of the things that we can do is recognition certifications. Some folks had suggested that maybe there's a way to give hazard pay for those that are covering down additionally. I don't know what your income sources are. All we're doing is presenting the things that folks have talked about. Make sure that your operators, your staff, your field crews, whether they're on the collection side or the distribution side, wastewater side, whatever they're doing, make sure they understand how critical they are and that we're thanking them and sharing that thankfulness and that gratitude. Let them know that without them, this pandemic is going to become an even bigger crisis than it would be having the fresh water, having the sanitation. Talking to Dwayne this morning from ODW on VDH's side, they said if you would like, they can produce a letter of support and thanks, basically kind of like a certification. Thank you for your assistance through this crisis. and it'll come from ODW. And that might be a good thing for utilities to try and get that, and maybe something they can post in their lobbies or post in their portfolios of things they've accomplished. Create challenges and fun environment. This goes back to Steve's comment earlier of last week. Focus on critical role of the job and how it positively impacts and helps our citizens in this time of need. So that, I thought those were some good comments. We're open to suggestions, anything that you guys feel or that you guys are implementing on your own to help with employee morale. We would love to hear about it if we can share it across to the other utilities. And then I'm going to turn this part over to Scott so he can talk about this in the next slide, and then I'll come back and talk about safety issues.
Yeah, just real quick, it looks like it was shared from Virginia Beach. They're doing an ugly mask contest for employees, so that kind of fits in that vein of shift competitions, different ideas. So
you'll have to ask Jim, do you actually have to wear a mask, or does my face count well enough as it is to win the ugly mask contest?
All right. We're going to go to the next slide. Yeah, just to share with everybody, this is, as Ike mentioned, it's extremely important to keep staff apprised. You know, in our case, our executive director is completing regular updates to staff to keep them aware of developments, situations that are occurring that they need to be aware of. But equally important is, more than likely with what we're seeing with this virus, a utility is going to experience a positive case. So we think it's extremely beneficial for each utility to think ahead about how they're going to communicate that out to their staff. You know, this is going to be, we've all seen it as the virus and the cases have progressed. There's an impact to employee morale when you see the first case that's in an adjacent jurisdiction in your jurisdiction. Then typically, like in our region, then we see one of our localities had a positive case in one of their public works departments. So as the news media picks that up, those things begin to weigh and potentially be a concern to employees. The last thing that you want as an organization is for your employees to hear about a positive case within your operations from a news source instead of having advance notice from your utility, from your human resources office. So this is an example that's been put together that we will utilize for notification of our personnel. It's been we've tried to make it more generic to make that available on the Warren website, so that you can actually take this to insert your specific information for your utility to have an effective communication. We do try to highlight, obviously, one of the things that we all have to be aware of are the HIPAA requirements on privacy. So we want to make sure that we're very cautious that there's no specific identifying information that's communicated out that could identify the employee. And unfortunately, with the time we live in, you know, we felt it necessary to put the additional privacy statement in, ensuring and asking for any staff to not share this information, social media, all those things. That's obviously a risk. This is information that's being communicated specifically to employees. And so we felt like, you know, a lot of agencies probably have thought through this. For those that haven't, you could either start with this as a starting point, develop your own language, but we would strongly encourage you to be prepared and have your crisis communication package ready to roll, because that's going to be part of managing employee morale. If there's a perception that we're not managing, that we're not aware of the situations around us, that's where we begin to see breakdowns in crisis response within organizations.
Absolutely. Bad. There's nothing like the operator or the field folks, the maintenance guys thinking that upper management's hiding something from them. They just get very hinky about that. We want to be out front, like Scott was saying, and this is a good way to at least start that process if you haven't really thought about how you're going to deliver that information to your staff. This is good info. I'm going to talk a little bit around safety issues. So far, the biggest thing that we keep hearing about is PPE shortages, primarily around face masks and gloves. We talked about these face masks. They're adding this face mask challenge. How many can you produce? Can you produce enough to maybe get out to nursing staff as well as hospitals and other folks if you can't just get it for your own folks? Kind of try that, and that way you can maybe get some family members involved. I'm not everybody likes to sew or do crafts, but those that do, this is something they can get involved in. PPE, one of the things we talked about this last week as far as gloves, maybe putting something on our site showing the proper donning and doffing of gloves. I've been watching a lot of people wear them, and they touch every surface with the same piece of glove or the same pair of gloves. They never change them, and then they go and adjust their glasses, or they grab a cigarette with that same glove, and they just basically anything they were wearing them for, they just negated it. So there's a proper way to put them on, take them off, and knowing when to change them. The biggest thing is making sure we're hand washing. The CDC information guidelines is that the soaps, the warm water, the hot waters and soaps are actually doing a better job breaking this down than just using hand sanitizers, because you're actually breaking the outer skin of the virus and killing it. And there's, it's not just a quick hands under. Here at our house, we talk about saying the ABCs all the way through and making sure you're scrubbing between your fingers and getting your fingernails and everything clean. So that's a safety issue to try and help. And then the big one is going to be, we talked about this, and we received an email about this after our last one, is that operator preparedness piece. What are we doing about having enough operators when we start seeing that crisis state, or we start losing folks to either quarantine or they have to be self-isolated because a family member may have had a positive? How are we covering down on that? Some of the resources we talked about or ideas we talked about was video logging, how we do our day-to-day operations. So if I have to bring an operator in that has no understanding of my process, at least I videoed it so they can video one, how to start up this process, video two, how to do this process, video three, how to do that process. And so that's one thing we can do. Another thing is, and if those shifts where we have 2, maybe 3 operators, maybe we're augmenting one of those operators with maintenance staff. So we're keeping some operators in reserve. Not that we want to put the burden on everybody, but we're doing some cross training. So if we have to isolate an operator, maybe they can still log in via Skype or something else, see what's going on and be able to talk that person through, but that person has some knowledge because they've been cross-trained enough to know what switches to turn or buttons to push or control measures to take, and we're starting to train them up. It's not that they're operators, because we still have an operator overseeing them, but at least we have a set of hands there that can do some of that work for us through guidance that an operator can't be there for because they're out of the loop. And then overall security, we talked about this, and we're starting to see it. As everybody knows with Zoom starting to have some security issues, but we're seeing this on other platforms too. The Macs are starting to be hacked now through the Safari, Internet Explorer. So we want to make sure both our digital security and our physical security don't start lacking so much that we create another complication for ourselves. And we talked about that a little bit last week. If anybody needs more guidance, please send any of us an email, and we'll try to help you out with some of that. Does anybody else want to speak on that? Yes, sir.
Yeah, if I want to mention hand sanitizer, we provided instruction on the website from World Health Organization for options to be able to make that internally. I know some folks have taken that as an option. Some of the supply issues, it's forcing us to think outside the box. Distilleries around the state, a number of those are transitioning their operations to produce hand sanitizers. That may be an option that you can reach out to a local distillery explain you are in a essential business, particularly water, wastewater, I think they would agree that's a higher priority. So you may be able to find effective partnerships. In our case, we received a communication from our uniform provider. I want to be hesitant to plug anybody, but they have been able to make arrangements for those that are government agencies with them to be able to get bulk hand sanitizer. This morning, I know our agency placed an order for one pallet. One pallet was 144 gallons. It comes in gallon containers. If anybody is interested in that specific contact, I'd be happy to provide that outside the call. And then PPE, we've been successful. There's a number of clothing manufacturers, other companies that are shifting their production for masks. In our case, we had another utility director who had given us a heads up that a athletic clothing supplier had masks that had just been approved under the emergency authorization or emergency approval by FDA as N95 equivalent. So we last week we kind of talked about the thought that CDC would likely issue guidance. So actually today we're accomplishing distribution of the new cloth face mask to all of our employees across our organization. And so I think that's the main thing on PPE and hand sanitizers, for us to all be actively and proactively looking outside our traditional supply chains for other opportunities. And I know in our case for the masks, we were able to order 1,000 masks, if that gives you an idea of magnitude. And so I think it's going to take some additional work, but it's also utilities helping utilities, that as one utility may find a source that helps other utilities, that's what Warren's for us to be able to help out and share that type of information.
Absolutely. Absolutely. And some of the other stuff we hung on our site is, how to make the basically the Clorox wipes for your workstation and things like that. So if this is your first time listening in, you weren't on with us last week, definitely go and check out that Warren webpage, and look at what we have on there. There's a lot of useful information. And like I said earlier, when I say we, mostly Geneva is updating that on a daily basis with new information as it comes in. One of the other things I'd like to speak about still on the operator piece, and I believe we have 2 poll questions we want to put up. One is on supply shortages and one is on operators. So I'll let post.
Which poll would you like first, Ike?
Let's do the shortages poll first.
All right. Have you been working operator shortage plan?
Correct. We can do operator shortage.
All right.
So you'll see some of these questions, if you listened in last week, are similar. And the reason some of these are similar is because they're points that need to be hit on a continuous basis. And they're also metrics that both EPA and AWWA National are tracking. So we have to constantly be giving information. And the best way to get it is to poll you guys when you're on these calls. So around your operator shortage plan, what are the things that you guys are looking at? And you can post these in the chat. Aside from if you are having them or not having them, what are the things that you as a utility are doing to overcome that staffing? And it can be both operators, it can be field crews or whatever. Some of the things I would like to post to you is, have you reviewed your COOP plan? Have you taken a look at it and see what your COOP plan says for recoverance of operators? Have you looked in depth at any of your retired operators that you still may be able to call back to duty to put back to use should you need them? Not just using the Warren and rural water to get operators, but have you looked at maybe a way to partner with your neighbors should they have a shortage or you have a shortage, or maybe you can cover down and still operate both sides of the house if you needed to, or any other methods that you may be researching. If you can post some of that in the chat, then we'll try to capture that for people to have. I'll give you a few minutes or a few seconds.
Yeah, it looks like HRSDs indicate they're talking to retirees. Good suggestion from Virginia Beach, coordination with other departments, Public Works, Parks and Recreation. So it sounds like everybody's getting fairly innovative to begin to think through and address potential operator shortages.
Good. All right, and Geneva, I believe we have the next one on supply chain.
Okay. Well, those results, by the way, where we had 82% said yes, they have started working on their operator shortage, and 18% said no. And now we would like the off staffing. All right, so here's a second staffing question. Talking about different areas in which you might have seen a staffing impact.
And this one, I believe, this is the one that's driving towards both your admin staff, your engineering staff, your management staff. And by impact, what we're talking about is not just you have an employee that's sick, but maybe an employee that has a family member, and so that employee has to be isolated until they come back. Or maybe an employee had to leave work because they do have an impacted family member that now needs their full-time care.
All right, we've seen a good number of responses. A few more coming in, though. I'll give it another second.
Okay.
All right, we'll end the poll just so we can share the results here. One moment. All right, so we have seen a 14% impact to treatment operators. Of the total of 9 people selected that one. 8% for distribution collection operators. 5 people have been affected by that. 2% for their management and engineering staff. 11% administrative customer service. 7 people, and then the vast majority, 74%, are very happy to say no staff impact. So 49 people responding as no impact at all yet.
But as a Virginia water wastewater professional, I think that's important for us to hear that we are starting to see those impacts inside our utilities. And we need to really be looking at what we can do to partner with those folks where they need it and try to help them out. All right. So my next slide is supply updates. And we've
already been there.
We've already been there. We already posted that poll question on that one about the percentage of what they're able to get or not get.
Not yet. You want that poll to go out? It's
yes, ma'am.
Going out. Here we go. And both the last poll and this poll, you are able to select more than one answer. If more than one fits, please feel free to select more than one.
And so what this poll question is driving at is, are we starting to look at our suppliers having impact? Can they still supply us at 100%, or are they having a degradation in service? And now we're looking, either we have to move away from that supplier altogether because they can't meet any of our needs, or we're using that supplier plus a couple other suppliers to make up what we were getting in the past. And we had one utility talk to us about it wasn't so much the supplier they were having an issue with. They had 2 fork trucks on site that they were using to unload supplies. One of those fork trucks broke down, so they're able to use their spare fork truck, but the fork truck service provider is no longer servicing fork trucks until further notice. So now they're back up. They don't have anybody to come out and fix it. So we're starting to see on the other side of the house, the service providers are starting to see impact. So that's just food for thought. And the reason I bring that one up is because I get in my head, I'm thinking about hurricane season and what are we going to do with these generators if we can't get service providers out to work on generators.
So I've shared the results of the poll, and Ike, since you don't have the luxury of being able to see the results, I'll let you know we had 34% say they have had to change their quantity because they couldn't order as many as they usually do. We've had 48% say they've had to use multiple vendors in order to meet their needs. 22 can't find any vendors to supply some of their needed items, and 40% are seeing no change in their vendors or their orders.
Gotcha.
So
That's a huge
would
So
like to-
60%. Oh, go ahead. I'm sorry.
And say if anybody has those concerns over vendors they cannot find supplies for, to put it in the chat window, and potentially we can help locate some of that.
Help bridge that, correct. So that's pretty interesting to hear. Not interesting, but that's pretty important to hear. That 60% of our utilities that took this poll are seeing some level of issue. And like I said, we haven't even got to the peak yet. So if we have the capability as a utility, maybe we have an abundance and we can share across, maybe we want to see what we can do to bridge those gaps too.
Like one thing that we found this week was at the UVA hospital. I talked to one of their nursing staff. They are allowed one disposable mask per week. It has to last them the entire week of that shift cycle. And all of our vendors are giving top priority to the hospitals, the nursing homes, fire department, and rescue squad. So we're way down on the list on trying to get some of our resources.
Gotcha. And this is where some of that out of the box may have to take place, where we start thinking about how do we make some of the stuff ourselves to bridge the gap until we can get, something industrially made to us. Some protection is better than none, but the main thing to keep in mind is if you do have some protection, you have some protection. You don't have full protection, so you still need to take some precautions as you're moving through this pandemic. Mike, did you want to speak to what you guys are doing as far as rotating your shifts in the morning, so you're not maximizing everybody like in your ready room or your truck pool?
Okay. During the week, our maintenance staff, we are assigning one person to a vehicle. Our crews, 1 week will work Monday, Wednesday, and Friday. The other crews will work Tuesday and Thursday. We again subdivide them so that one crew comes in at 7 in the morning and starts their day, and they're gone from the warehouse before 7:30 when our second group comes in. We just got a shipment of hospital grade spray cleaner, and we're divvying them out to all of our employees and getting for them to wipe their vehicles down inside and out, anywhere that the hand would possibly touch, because somebody else will be likely using that vehicle the next day. Yesterday, I found a source through Etsy, and I've ordered 90 cloth face masks that should be here the first part of next week. So Etsy might be a resource for somebody looking for masks if they don't have people that can make them.
Gotcha. And just so everybody's aware, I've heard of people ordering masks, I think it's off of Groupon, where they're getting double billed for masks and then the masks don't show up. So make sure you research who you're going to get your stuff from before you just give them your POs or your money. I'm not trying to speak against Groupon. I'm not trying to speak against anybody. I'm just saying that was something that was brought up, that some people were having some issues. So just make sure you know who your vendor is, that you're using somebody reputable if you can. Scott, did you want to say anything? Oh, I'm sorry. Go ahead, Mike.
Also, as a backup, talking about the forklift issue, if they have maintenance contracts on their generators and their equipment, they should probably make sure going forward, if it's not in their documents now, that there is a response within so many hours of the call being placed.
And I think that's good ERP practice also. And then as we speak about everything with ERP, who's your primary vendor, who's your secondary vendor, who's your tertiary vendor? You shouldn't have to live or die by one vendor. You need to be able to have some in-depth, and if you don't, absolutely reach out to the Warren, and we'll see what we can get for you as far as some vendor contacts. I know Mike and Scott both are a wealth of information on finding those kind of people, and I mean, that's what we're here for. And like I said, this is open to both Warren members and non-Warren members. If you're having these issues, you're running into problems finding things, let us know. Let us help you out. You don't need to be out there by yourself trying to figure it out. Scott, do you have anything you want to say here?
It looks like we've Looks like we've had a number of requests with regard to the source for mass I mentioned earlier. I've sent that on to Geneva, and so we'll try to get that out to those that requested it.
All right. Make sure I hit all of our talking points here. So one of the things that I was talking about last week, and we just briefly touched on it, and I just wanted to stay kind of in everybody's kind of forethought. There's not a lot of documentation yet on where the workman's comp claim ends and where personal liability begins and where any of this happens. And right now we've been pretty fortunate in the utility that we haven't had to make many claims, but that's a conversation you may want to have with your legal counsel going forward. Should you have an employee that becomes infected either through work or through contact at work, who and how are you compensating that in the end? Nobody's really set the precedent on that I've seen. Right now we've been handling under sick leave and then emergency health leave. But it's a lot more clear cut when we're doing a hurricane response or some other response. If somebody gets hurt, you know, it's easy to quantify. You can see somebody's lost a finger or has got a cut or has this or has that, and there's a dollar value associated with it and compensation associated. This is a little different. This is kind of new territory, uncharted territory. So just have that conversation before you send your employees off to assist thinking you're going to get something back. The WARN, I just want, the reason I'm leading into this is the WARN agreements don't really lay out what happens if somebody becomes sick from a response. It lays out more how do you get compensated back for items that are destroyed, employees that are hurt, different things like that. So I just want to make sure you're having those open conversations, especially if you're going to fill a request with that receiving party, with your legal counsel, and make sure you have a good understanding of what you're getting ready to obligate to.
There's another aspect.
Go ahead.
There's another aspect to that too, Ike, that we understand and we're pursuing an answer today from our insurance carrier. Is there was a decision that may impact utilities about recordability of any coronavirus COVID-19 cases that you have within your workforce, that may need to be documented as a recordable illness in the OSHA log. And so there was an earlier decision on that. It tend to be grouped into similar vein as tuberculosis. And so we're reaching out to our insurance carrier for some additional assistance and resources to understand whether, if we see these type cases, do we need to indeed record those and make sure we're documenting it properly.
Perfect. I'm sure other utilities are having those conversations. If you haven't had those conversations, hopefully this is food for thought for something for you to take forward and start thinking about and start, because you don't want to try and figure it out after something's happened, figure out who's going to be holding the liability issue there. You want to have that laid out ahead of time as best you can. All right. And I believe our next slide takes us to how to become a member of the Virginia WARN. And Geneva, is this one you want to talk to?
Sure. So if you are interested in becoming a member, because you are currently not a member, there's just 3 documents that do need to be completed. The mutual aid agreement needs to be signed by an authorized representative from your utility service authority. An adopted resolution or ordinance needs to come from your governing body, be it a board or a board of supervisors, town council, whatever your overarching authority is. And then the authorized representative form simply is a listing of individuals that you would be putting into the database to receive communications or to communicate out on behalf of your organization. So those 3 documents are all available on our website. The link is there at the bottom. vawarn.org is the central website, and then there's all of our other links that we've spoke to today there with the information. It is a free sign up. There's no commitment. You simply can get involved in the program, get all of the paperwork done in advance, and then should you need assistance or should you wish to provide assistance, the provisions are in place ahead of time.
So moving forward, our next slide is going to be on questions, but I just want to kind of let people know one of the things that we're going to do is the warn is we're going to try and reach out to DPOR and find out what's going to happen with operator licensing requirements or other licensing requirements during this time. Are they tabling them and let them grandfather over till the end of the crisis? So I've already kind of sent some emails out. As soon as we have that information, we'll probably include that in next week's updates. But if there's anything else that anybody would like information on, if you can share it with us, and I believe the next slide has contact information, share it with us or go to the WARN site, and I think we have a way that you can post that information there so we can get that information together. Because if you have that question, I'm sure other utilities, other operators, other folks have that same question. They just might not know how to word it the same way you do. So please, by all means, share with us anything that you have concerns about that you're looking for that we might be able to push those answers for. Mike, Scott, do you have anything on that?
No, I'm good.
If they have any questions, just give us a call.
Okay. All right. Geneva, do you have anything?
I was just going to say thank you, everyone, for joining the call. We do apologize for the few inappropriate chats that were posted. We were kicking people out that were not allowed to be here. We may be modifying the way we move forward, obviously with the concerns with Zoom, as well as people that can get this information. We have been trying to make it very widely available by posting it on our website, but obviously that might need to change since non-utility, interested parties are starting to join the call this week. We'll be looking at that, and if our connection information changes, we will update you and send out emails as soon as we can. Thank you, though, for attending. Be looking for the recording to be posted on the website, and don't hesitate to reach out to any of us if there's anything that we can do to help you.
Every Wednesday at 1 o'clock, we'll be doing this until the end.
Wednesday
or until we're told not to.
Well,
all
thank
right,
you all.
everybody.
I'll be ending the call, and have a wonderful day.
Thank you.